Welcome back, everyone. Today, we're going to delve into an important topic that affects children and sometimes even adults: hand, foot, and mouth disease, or HFMD. In this video, we'll explore what HFMD is, its symptoms, how it spreads, and essential tips for prevention and treatment. So, let's get started. What is hand, foot, and mouth disease, HFMD? Hand, foot, and mouth disease is a common viral infection that mostly affects young children, although it can occur in people of all ages. It's caused by different strains of the Enterovirus, particularly the Coxsackievirus. The disease gets its name from the characteristic rash that appears on the hands, feet, and mouth of those infected. Brief history of HFMD. Hand, foot, and mouth disease, HFMD, has been recognized as a distinct clinical entity for several decades. Here's a brief history of HFMD. Early notable outbreaks. The first documented outbreak of HFMD occurred in Toronto, Canada, in 1957. Several cases of a previously unidentified viral disease were reported in young children, with symptoms including fever, oral ulcers, and a rash on the hands and feet. Discovery of enteroviruses. In the 1950s and 1960s, enteroviruses were identified as the causative agents of many viral infections, including HFMD. Specifically, the Coxsackievirus A16 was isolated from patients with HFMD and later recognized as one of the primary culprits of the disease. Emergence of other enteroviruses. In addition to Coxsackievirus A16, other enteroviruses, particularly Enterovirus 71, EV71, were also identified as significant causes of HFMD outbreaks, especially in Asia. Increase in HFMD cases. From the late 20th century to the early 21st century, there was a noticeable increase in the number of HFMD cases reported globally. The disease became a growing public health concern, particularly in Asia. Ongoing impact. HFMD remains a prevalent infectious disease worldwide, affecting millions of people each year, primarily young children. Although most cases are mild and self-limiting, severe outbreaks can lead to hospitalizations and, in rare cases, fatalities. About causal agent of HFMD. The causal agents of hand, foot, and mouth disease, HFMD, are primarily enteroviruses, belonging to the Picornaviridae family. The two main types of enteroviruses associated with HFMD are Coxsackievirus A16, CVA16, and Enterovirus 71, EV71. Enteroviruses are small, non-enveloped, single-stranded RNA viruses. Here is a brief overview of their structure. Capsid. The outer shell of the virus is called the capsid, which is composed of protein subunits. The capsid protects the viral genome and plays a crucial role in the virus's ability to attach to and enter host cells. Genome. Enteroviruses, including those causing HFMD, have a single-stranded, positive-sense RNA genome. This RNA serves as the genetic material of the virus and carries all the necessary information for replication and viral protein synthesis. Proteins. Proteins include structural proteins, responsible for forming the capsid, and non-structural proteins, which are involved in viral replication and evasion of host immune responses. RNA polymerase. Enteroviruses carry an RNA-dependent RNA polymerase, an enzyme essential for replicating the viral RNA and producing more copies of the virus. How HFMD transmits. Hand, foot, and mouth disease, HFMD, is primarily transmitted through direct contact with an infected person's respiratory secretions, saliva, feces, or fluid from the blisters or sores caused by the virus. Here are the main modes of transmission. Person-to-person contact. The most common mode of HFMD transmission is through close contact with an infected individual. When an infected person coughs, sneezes, talks, or touches objects, they can release the virus into the air or onto surfaces. If someone else comes into contact with these respiratory droplets or contaminated surfaces and then touches their mouth, nose, or eyes, they can become infected. Fecal-oral route. HFMD can spread through the fecal-oral route, particularly in settings where hygiene may be compromised. Infected individuals can shed the virus in their stool, and if proper handwashing practices are not followed after using the restroom, the virus can be transmitted to others through contaminated hands or surfaces. Close contact with infected surfaces. The virus can survive on surfaces for some time, especially in areas where infected individuals have touched or deposited respiratory secretions or saliva. Touching these contaminated surfaces and then touching the face, especially the mouth, nose, or eyes, can lead to transmission of the virus. Mother-to-child transmission. Infected mothers can potentially transmit the virus to their newborn during childbirth or through close contact with their baby afterward. Pathogenicity of HFMD. The pathogenicity of hand, foot, and mouth disease, HFMD, is primarily attributed to the two main causative agents, Coxsackievirus A16, CVA16, and Enterovirus 71, EV71. HFMD is considered a relatively mild viral infection in most cases, but severe complications can occur, especially in certain populations. Its pathogenicity include entry and replication. The virus enters the body through the respiratory or gastrointestinal tract, where it targets cells lining the throat and intestines. The virus attaches to specific receptors on the surface of these cells and enters them, taking over the host cell's machinery to replicate its genetic material and produce more viral particles. Localized infection. The initial infection leads to localized symptoms in the throat and mouth, including sore throat, fever, and the development of painful sores or ulcers in the oral cavity. These symptoms typically resolve within a week or two. Spread and rash. After the initial infection, the virus can spread to other areas of the body, leading to the characteristic rash on the hands, feet, and sometimes buttocks. Transmission. HFMD is highly contagious, and the virus can spread easily from person to person through respiratory droplets, saliva, fecal matter, and fluid from the blisters or sores. Severity and complications. In the majority of cases, HFMD is a self-limiting illness that resolves without complications. However, in some instances, particularly with EV71 infections, the disease can lead to more severe outcomes like high fever and neurological symptoms, and in rare cases, even fatal complications may occur. What are the symptoms of HFMD? The symptoms of hand, foot, and mouth disease, HFMD, typically appear within 3 to 7 days after exposure to the virus. Common symptoms of HFMD include fever. HFMD often begins with a fever, which can range from mild to high grade. Sore throat. Many individuals with HFMD experience a sore throat or discomfort while swallowing. Mouth sores. Painful sores or ulcers can develop inside the mouth, on the tongue, gums, and inside the cheeks. These sores can make eating and drinking uncomfortable, especially in young children. Skin rash. HFMD is characterized by a rash of small, red spots or blisters that may appear on the palms of the hands, soles of the feet, and sometimes on the buttocks. The rash can be itchy and may cause discomfort. Reduced appetite. Due to the mouth sores and sore throat, individuals with HFMD may have a reduced appetite and may not feel like eating. In most cases, HFMD is a mild and self-limiting illness that resolves within a week or two. However, in some instances, especially when caused by Enterovirus 71, EV71, the disease can lead to more severe complications, such as aseptic meningitis or encephalitis, which may require medical attention. How to diagnose HFMD? Diagnosing hand, foot, and mouth disease, HFMD, is usually based on a combination of following actions. Clinical assessment. A healthcare provider will begin by reviewing the patient's medical history and asking about their symptoms and recent exposure to potential sources of the infection. Physical examination. The healthcare provider will conduct a physical examination to check for characteristic signs of HFMD, including the presence of mouth sores and skin rash. They will look for typical symptoms of HFMD, such as fever, sore throat, mouth sores, and a rash on the hands, feet, and sometimes buttocks. Viral culture test. A sample may be taken from the throat or a blister to identify the virus causing HFMD. Polymerase chain reaction, PCR testing is a more rapid and sensitive method to detect the presence of the virus's genetic material in a sample, such as throat swabs or stool samples. What is treatment for HFMD? Currently, there is no specific antiviral treatment for hand, foot, and mouth disease, HFMD. Most cases of HFMD are mild and self-limiting, and the infection resolves on its own within a week or two. Here are the main aspects of treatment for HFMD. Fever reduction. Over-the-counter pain relievers like acetaminophen or ibuprofen can help reduce fever and alleviate discomfort. Always follow the recommended dosage for the appropriate age group. Pain management. Mouth sores can be painful, especially during eating and drinking. Avoid acidic and citrus foods that may further irritate the sores. Hydration. Encourage the infected person, especially children, to drink plenty of fluids to stay hydrated. Rest. Get adequate rest to support the body's immune response and recovery. Good hygiene. Practice proper hand hygiene by frequently washing hands with soap and water, especially after using the restroom or coughing, sneezing. Medical evaluation. In severe cases or if complications are suspected, medical evaluation is crucial. How to prevent HFMD. Preventing hand, foot, and mouth disease, HFMD, involves taking several preventive measures, which include: practice good hand hygiene. Wash hands frequently with soap and water for at least 20 seconds, especially after using the restroom, before eating, and after coughing or sneezing. Avoid close contact with infected individuals. Limit close contact with individuals who have HFMD symptoms, such as fever, mouth sores, and rash. Maintain clean and sanitized environments. Regularly clean and disinfect frequently touched surfaces, such as doorknobs, toys, and communal items, using an appropriate disinfectant. Keep infected individuals home. If someone in your household or community is infected with HFMD, it's essential to keep them isolated at home until they are no longer contagious. Educate and raise awareness. Educate yourself and others about HFMD symptoms, transmission, and prevention measures. Conclusion. Understanding hand, foot, and mouth disease is crucial for taking the necessary precautions and seeking timely medical attention. Remember, good hygiene practices and preventive measures can significantly reduce the risk of spreading HFMD to others. If you found this video informative, give it a thumbs up and share it with others to create awareness about this common viral infection. Thank you all for watching. Don't forget to subscribe to our channel for more informative content. Stay healthy, and see you in the next video.